Hello, hello, hello. Welcome to Thursdays Lives with Whitman-Walker. Whitman-Walker sharing some information here with Whitman-Walker. Come on in. Hello, hello. Happy Thursday. Come and join us for today's talk with Whitman-Walker. Welcome, welcome. Good afternoon, everyone, to our lives this week. Oh, we miss you guys too. Stay tuned, stay tuned. Hello, hello. How are you, Brandon?
I am doing just great, Orlando. I'm a little cold, but hanging in there.
Nice, nice. Welcome, everyone. We're going to have our chats, our Thursday chats with Whitman-Walker today. Come on in. Wait a couple minutes for people to come on in. Let's see. Ready for Friday Eve? All right, so let's get started. Let's see. So for those of you that don't know, I do work with Whitman-Walker, a social media influencer, talking about things that, go on with a lot at this time. So today we'll be talking about STDs at an all-time high. So come on in. If you miss it, you can always catch it on Whitman-Walker's page as well as mine. Today we're going to be talking about the new CDC reports released last week that show how in 2019 reported cases of chlamydia, gonorrhea, and syphilis have increased for the 6th consecutive year, reaching a new all-time high. The big takeaway is that STDs are a big problem for Americans. Chlamydia, gonorrhea, and syphilis infections remain common, costly, and challenge the health and wellness of millions of people across the United States. And they can be prevented in very simple ways, like using condoms and getting tested frequently. So let's look at some data. Hello, hello. Thanks for joining, everyone. Come on in. So as of chlamydia, let's start with that. In 2019, a total of 1,808,703 cases of chlamydia were reported to the CDC, making it the most common notifiable condition in the United States for the year. That case count corresponds to a rate of 553 cases per 100,000 population, an increase of 3% compared with the rate in 2018. DC had a higher rate than all 50 states. 1,328 cases per 100,000, which is more than double the national average. Although rates reported cases among men are generally lower than rates among women, rates among men increased 32% during 2015 to 2019. Rates of reported chlamydia are the highest among adolescents and young adults. In 2019, almost 2/3 of all reported chlamydia cases among persons of age 15 to 24. Among females aged 15 to 24 years, the population targeted chlamydia screening. The overall rate of reported cases of chlamydia was 3,728 cases per 100,000 females, an increase of 10% from 2015. As for gonorrhea, in 2019, a total of 616,392 cases of gonorrhea were reported to the CDC, making it the second most common notifiable condition in the United States for the year. Rates of reported gonorrhea have increased 92% since a historic low in 2009. During 2018 through 2019, the overall rate of reported for gonorrhea increased 5.7%. Again, DC has the highest rate in the country, 624 cases per 100,000. Hello, hello. Come on in, guys. We are talking about STDs being at an all-time high right now. So since 2013, the rate of reported gonorrhea has been higher among men compared to women. Among men, the rate reported of gonorrhea increased 6% during 2018 through 2019 and 60% during 2015 to 2019. Recent studies suggest the estimated rates of reported gonorrhea among men who have sex with men, also called MSM, are 42 times the estimated rate among men who have sex with women. Only, however, increases the rate of reported gonorrhea among MSM appear to have slowed in the past several years. Among women, gonorrhea rates have increased 5% during 2018 to 2019 and 44% during 2015 to 2019. So if you guys have any questions or ask, you can go ahead and ask here. If not, if you want to ask in private, please send us a message to Whitman-Walker and they can get you any answers or information. I put down here information of testing available by appointment only. So please take a picture of that phone number or email and we can get you guys set up. All right. So as for syphilis, in 2019, a total of 129,813 cases of all stages of syphilis were reported. When we think of syphilis, we usually think of what's called the primary and secondary syphilis when it's spread through sex. And in its earliest stages, since reaching historic lows in the 2000s and 2001, the rate of primary and secondary syphilis has increased almost every year, increasing 11% during 2018 and 2019. So since 2000, rates of primary and secondary syphilis have increased among men, probably because of its increases in cases among MSM. For those of you that don't know, that's men who have sex with men. So MSM are disproportionately impacted, accounting for over half of all male primary and secondary syphilis cases in 2019. Although rates of primary and secondary syphilis are lower among women, rates have increased substantially in the years, increasing 30% during 2018 to 19 and 180% from 2015 to 2019. So that probably means that the heterosexual syphilis epidemic continues to rapidly increase. Now, disparities in STD. As in the past, there were big disparities in rates of reported STDs. There were age disparities. Over half of reported cases of STDs were among adolescents and young adults aged 15 through 24 years. There were racial disparities. 30.6% of all cases of chlamydia, gonorrhea, and syphilis were among non-Hispanic or blacks, even though they made up only approximately 12.5% of the U.S. population. There were LGBTQ disparities. MSM were disproportionately impacted by all STDs, but especially syphilis and gonorrhea. It is important to note that these disparities are unlikely explained by differences in sexual behavior and rather reflect differential access to quality sexual health care, as well as differences in sexual network characteristics. For example, in community with higher prevalence of STDs, with each sexual encounter, people face a greater chance of encountering an infected partner than those in lower prevalence settings do, regardless of similar sexual behavior patterns. Acknowledging inequities in STD rates is a critical first step toward empowering affected groups and the public health community to collaborate in addressing systemic inequities in the burden of disease, with the ultimate goal of minimizing the health impacts of STDs on individuals and populations. Thank you everyone who's joining in. If you missed the beginning part, please, you can catch it on my timeline or Whitman-Walker's as well. The information is here about getting tested, so please contact us if you need that. As in prevention, there are a few ways that you can stop the spread of STDs. Use condoms when you have sex. Condoms prevent against the transmission of gonorrhea, chlamydia, and syphilis, and they are really effective when used correctly. Get tested. If you know that you are negative, you can't spread anything to your sexual partners, and if you happen to be positive, you can get treated easily so that you don't spread any infections to your sexual partners. Going along with that, make sure your partners get tested, using the same logic that if your partners get tested and their results come back negative, they can't give you anything. If your partners get tested and results come back positive, they can easily get treated so that they don't spread any infections to you. Consider having a mutually monogamous relationship. That way, you and your partner only need to get tested once. And as long as you're each other's only sex partners, you can't get any STDs. Educate others about STDs and their spread. So many people don't know this information, and you can help your friends, neighbors, community by sharing this information. Or choose not to have sex at all. This one can be difficult for some people, but others find comfort in having themselves as their only sex partner. Now, what's a little scary about gonorrhea, chlamydia, and syphilis and other STDs is that many of them are asymptomatic, meaning you can't tell if you have them, but if you do have them, they can harm your health and you can spread them to others. If you're not sure about your status or you just want to get it checked to be sure, Whitman-Walker offers free HIV STI testings at our Liz location in Northwest DC and our MRC location in Southeast DC. So you can make an appointment by calling 202-797-4439. The number is pinned below. So if you have any questions you were asking, let me check real quick. Looking good, no questions. And they are putting information down here. So again, if you have any questions, please send us a message and we can get to you as we can. So as I wrap up, pun intended, I'll just remind people about sex and other virus, COVID-19. So as we know, COVID-19 is a virus that can spread when you are within 6 feet of a person with COVID-19 who coughs or sneezes. So if you get near someone, like when we're getting intimate, you're putting yourself at risk. So make sure that you're, one, staying at least 6 feet away from other people when possible, wearing a mask in public, avoiding places with large crowds, encourage working from home if possible, speak with loved ones on the phone over FaceTime instead of in person, social distancing as caring for your community, stay up to date on your local, state, and national guidelines for testing, quarantine, and general safety, washing your hands for at least 20 seconds at a time, and stay home if you don't feel well. Everyone in the U.S. is eligible to get their COVID-19 vaccine, so make sure that you sign up. You can visit your jurisdiction's website to register. When it comes to having sex, you are your safest partner. Masturbation will not spread COVID-19, especially if you wash your hands or any sex toys with soap and water for at least 20 seconds before and after sex. And you can follow us on Whitman-Walker, Twitter, Facebook, Instagram, at Whitman-Walker or at Real Talk DC _ to stay up to date with all things Whitman-Walker Health. Thank you so much for tuning in today. I appreciate you all. Let's see if we have any questions. No questions. Don't forget, if you want to ask something, please write us to Whitman-Walker. Or if you send me a message, I'll get you in touch with whoever I need to answer your questions. We appreciate you all. We are here. Stay safe. We see you. We understand you. And have a great Thursday, everyone. Thank you, Brandon.
Thanks, Orlando.